Oh, I've got 36 after, so we can go ahead and get started. So thank you everybody for joining us this morning to talk about reproductive and sexual health and domestic violence programs. The great thing about what we're going to talk about today is you're going to get a lot of different information from people who have been working in this field. So I want to start just by having our fellow panelists introduce themselves. I don't know, Leigh, do you want to start?
Sure. Hi, everyone. I'm Leigh Hofheimer with the Washington State Coalition Against Domestic Violence. We're located here in Seattle with a tiny office in Olympia where our capital is. And I just wanted to let you all know that we have a sister sexual assault coalition here in Washington State too, called the Washington Coalition of Sexual Assault Programs, but we really share membership. So about half of our members are dual domestic violence and sexual assault advocates. So when I'm speaking with you all today, just know that I'm out there talking about DV and SA advocates. And for myself personally, I've been doing the work for a while, as you can see, and I started on a hotline in a YWCA, so I've had all the direct service jobs that you could probably imagine: hotline, shelter, in the court, out of the court, support group, and then eventually got to my dream job at the coalition. Yay! So I'm really happy to be with you all today. Thank you.
Thank you. And Brooke, do you want to introduce yourself?
Hi, good morning, everybody. This is Brooke Ely-Milen. I'm the director of the Domestic Violence Program at the Colorado Department of Human Services. And I am here today because our department and Violence Free Colorado and Colorado Community Health Network are all part of a really exciting project that many of you either are directly involved with or have hopefully heard about, called Project Catalyst, which I'm sure Liz is going to talk about a little bit more. And when we joined Project Catalyst, we heard about the reproductive justice work that was being done in a couple other states, and we were connected to the wonderful people at the Washington State Coalition, and we're really excited to be bringing this information here. And I'm going to talk a little bit later today about some of the resources that DVP will be providing to community-based organizations to help with this work. So thanks, Liz, for organizing all this, and I'm really excited to be here.
Thank you so much, Brooke. And my name is Liz Stewie. I'm the Training and Technical Assistance Manager at Violence Free Colorado. We are here today because we started working with Futures Without Violence and Project Catalyst to start really bringing together domestic violence programs and community health clinics to talk about the important intersections of health and domestic violence. And so all of this conversation grew out of that project. We are great. So here are our learning goals for today. We're going to talk about what is reproductive and sexual coercion. We're going to talk about emergency contraception. We're going to talk about how emergency contraception and birth control can be a part of safety planning. And we're going to talk about the ways in which the different approaches you can use to incorporate that information into your programs, whether that be shelter programs or outreach programs or any other kind of services that you're providing to survivors. So this is just a quick definition of reproductive and sexual coercion. So essentially, it can be used as another tool of power and control in a relationship to maintain control over a survivor. That could be in an intimate or a dating relationship, and it happens to both adults and teens. So really what it is, similar to our traditional power and control wheels, it's another spoke in that wheel of a means that can be used to keep somebody in an unsafe relationship. And so what we're going to talk about are ways in which we can provide resources to survivors to help them manage that and be as safe as possible. So here are a couple of examples. So what does reproductive or sexual coercion look like? It can be explicit attempts to impregnate a partner against their wishes. It can be interfering with their method of birth control, either requiring somebody to have or not have an abortion. It can be coercing a partner into having unprotected sex. So there are a lot of different ways that this can look. It can also look like survival sex, meaning forcing somebody to perform sexual acts in order to get their basic needs met. And unfortunately, something that we see occasionally in our programs is something that somebody has struggled with or experienced. So this kind of shows the relationship. For anybody who can become pregnant, unplanned pregnancies can increase the risk of violence. And violence increases the risk for unplanned pregnancies. So they play off of each other. And we know that when folks are pregnant, that's a really vulnerable time for a lot of people. And that's where we need to do some really enhanced safety planning for folks when they're experiencing that. And then also just thinking about the ways in which experiencing violence, we also see this in human trafficking, that experiencing that violence can increase somebody's risk and expose them to times when they may experience an unplanned pregnancy. So National DV Hotline has reported that 1 in 4 calls over this period of time where they were surveying people had experienced birth control sabotage or pregnancy pressure. So that could be from destroying pills, not allowing somebody to see the doctor to get other forms of birth control, or damaging or refusing to use condoms. So here's just a quick overview of a couple of different emergency contraception options. So emergency contraception can be used as a safety planning resource and can be used as a tool for survivors. And it's something we want to let people know is available because not everybody knows what all of their health options are. These are just 3 common options that we see. Plan B is something that's talked about a lot. It's available over the counter, which is a great option. It's not always as effective for people who are considered overweight on the BMI index. So there is another that works similarly to Plan B called Ella, which can be more effective for people who are higher on the BMI scale. And then there's also the copper T IUD. And so that is an implantation device that can be a long-term birth control option, but it can also be used as emergency contraception if it's used within 5 days after unplanned sex or unsafe sex or any other situation where somebody might fear that they might be pregnant and are interested in taking steps. And so that is one of the main reasons why we're working to increase the partnerships between community health clinics and domestic violence centers, so that these options, it's the second 2 options, which are related to needing prescription or interaction with a medical professional, that somebody can have a quick and safe access to that medical attention that they need in order to get access to these things. So sometimes there is a little confusion about whether or not Plan B is the same as an abortion pill, and it's not. And I actually encourage you, there's a great little YouTube video that the link is here that talks about the science behind that and why that is true. But the medication does not cause miscarriage or abortion. It will not hurt somebody if they're already pregnant. And it can be taken up to 5 days after unprotected sex. But the sooner the better. And it's legal, safe, and available over the counter at pharmacies, including Walmart, but also in a little bit, Brooke is going to talk about some other options for accessing that. So sometimes people have questions about the legality or the safety for the risks for their program and offering these things. And since they're over-the-counter medications similar to Tylenol or ibuprofen or cold medicines, there really is a pretty pretty low risk for programs. And so having that available, even though it can seem like pretty low barrier, even if it's available over the counter, we know that the people that we work with are facing really extreme financial, transportation hardships. So even just the option to getting to somewhere to get the things they need is a real barrier for people. And so removing that and allowing them to have access directly through your programs, whether that be a residential or non-residential base, can be really critical for people, especially when you're thinking about the sooner that these are taken, the more effective they are. And so really making that as fast and as efficient as possible, if that is something that somebody wants, is really important for survivors. So here's a couple of reasons that survivors may need emergency contraception. This is good to just have kind of an understanding of how it works. But the great thing is that it doesn't really matter so much to us, right? Somebody wants this is something they have access to. So this just gives you a little background of understanding what might be happening. We have a question on the chat about age requirements. So because it's available over the counter, there is not an age requirement. You don't have to show ID at the store to access it when you buy it at a pharmacy or online. So there isn't an age restriction to buy it. But good question, thank you. So here is another great way when we're talking about emergency contraception and birth control. This is an excellent resource that you can have available for folks in your program. And we really recommend posting this somewhere so that folks have this information available. You know, just like a lot of things related to sexual health, folks don't often get the chance to be educated about their birth control or emergency contraceptive options. That's not included in all schools and programs, so a lot of people just don't have access to this information. So having this available in your programs can be really empowering. It also signals that that this is something you care about, that you care about a person's reproductive and sexual health, and that indicates to them that they could potentially come talk to you if they have more questions. And so kind of understanding these different types of birth control and emergency contraception can also influence your safety planning with the survivor if they indicate to you that that's something they're concerned about. So when we're safety planning, we talk about a lot of different things, right, with survivors. So just like we would with other items like important papers or documents or safety planning around picking up children from school or whatever the situation it is that you're working with the survivor, we can include emergency contraception, birth control, sexual and reproductive health in that safety planning. So, you know, if somebody is worried about hiding it from their abuser, an unsafe person, you can talk about ways in which those pills can be removed and put into different vessels to conceal what they are, different ways that different clinics that somebody may be able to reach out to in your community to access these things, maybe potentially in a different location that might be safer for them, and just generally opening up the conversation about what do you need to feel safe, what do you need to be well, and how can we help you reach that goal. So these are just some very general questions to think about, but really the survivor will lead the conversation and what they need, and you'll be there to be able to provide resources to them through that conversation. So now we're going to talk about two different approaches when you're talking to survivors about this. And so they can be used together or separately. They can be used in different programs within the same agency. Really, it's up to you to think about these different methods, what works best for you, what works best for the people that you're serving, and to really, when you're utilizing either of these approaches, to really get feedback from survivors, to talk to them about what works for them, how would they like to receive this information, so that you're really supporting the individual in what they need. So this is some suggestions from Futures Without Violence if you're going to use a screening approach. So a screening approach would be asking direct questions. Obviously, they would be optional questions. You could preface the asking of these questions saying that we have some questions we ask about sexual and reproductive health. If you want to answer them, you can. If not, that is totally fine. We just want you to know that there are resources available to this. And so Futures identifies that there are some things you may want to talk about upfront with a survivor, something that may be more immediate. So that's obviously assessing for injuries or recent strangulation, medication and a safe place to store this. If you're in a residential program, that's really important to discuss. Allergies, talking about what a person might need in order to be able to fully access your programs. So whether that's a community-based or residential programs, thinking about what services are you providing, what comes along with those services, including food and other things. So just getting information about allergies can be really helpful. And then also asking if there are any reproductive or health or emergency contraceptive needs. So we know that emergency contraception works best when it's taken as soon as possible. And so having that be an immediate resource that you provide is important for the survivor. And then there are other things that you can screen for and talk to survivors about, but maybe that are not as urgent. So talking about health insurance coverage and enrollment, talking about if and where they're currently receiving medical care and how we can support continuing that relationship. If we're able to provide a survivor with safety resources or transportation or something else that allows them to continue receiving care from a trusted medical provider, that can be really important in somebody's healing. Support for alcohol and substance use. And then the holistic healthcare, other things that you have available, talking about what do you need to be successful in life or in our program. You need resources talking about health or nutrition or other supportive services that help a person feel like they can be their best selves and that they have access to the things that they need. And as always, we want to talk to survivors about why we're asking these questions. We're asking these questions because we want to provide you resources if that's something you're interested in, and about what the information will be used for. Just like we talk to survivors about the information that we collect and intakes about them, how that's going to be used, what their rights are regarding that information and the protection of that. We want to include that in any conversation we're having with a survivor about health. And then always, we want to offer these services to everybody, right? We don't want to assume any survivor's needs or reproductive needs based on their gender or what we assume their gender is. So we don't want to leave folks out of that important conversation. So Futures did a small survey where they were talking to, this survey was particularly about women, but they asked them how they felt after a domestic violence program was asking them about questions. And in this section, clients were overwhelmingly positive about that. But this is up to you to determine, right? You want to talk to survivors either informally in focus groups and surveys. However you get input from survivors in your programs, it's important to get input about how we're talking about health needs and concerns, especially sexual health and reproductive coercion. So just start those conversations, really listen to the survivors for what they need. So now I'm going to pass this off to Leigh, where she's going to talk about our next approach that's available for programs.
Hi, everybody. Liz, I just wanted to check in with you. How much time do I have to talk?
You have, so it's 5 till 11 here in Colorado right now. So we are doing great on time. So if you want 20, 30 minutes, that's fantastic.
Oh, okay. Okay, great. Well, I've got the chat box open too. Besides, you can also tell me, yeah, you have 2 minutes left.
Yeah.
So welcome, everybody. Good to see you. So thanks so much for that framework, Liz, to just get us going. And I just want to talk to you about how we used discussion around emergency contraception to really kind of open the door to talking about reproductive justice in our state with advocates, and how, you know, we learned that, yes, these are very important health needs, but really, you know, if we want to think about our role in advocacy as supporting people to have long-term solutions, to see ourselves as engaging in liberatory acts, there is another way to think more broadly about the role of emergency contraception and reproductive justice. So yes, it's very important to have access to birth control, but I think what we learned from listening to survivors and thinking about this, what we're really talking about is love, sex, family, and community. We want to be able to love who we want to love, be able to have sex, positive sex in the ways we want to have sex, be able to build the kind of families we want to build, be able to raise our children in communities where they have access to clean air, clean food, clean water, still think Flint, loving and just communities, and be able to support people who are parenting and their long-term choices and solutions around what's right for them. So if we think about ourselves as not just being more familiar with a health resource, but that we're really like, I mean this, we're really like engaged in liberatory action. I feel like as an advocate myself, seeing that big picture helps me understand the importance of this role. So in thinking about that, so many of us have different kinds of forms, including in Washington State, the folks that get our DSHS money, there's a question on the form that says, are you pregnant? And when we first started doing this work, people weren't talking about emergency contraception or birth control. This is generally, there's always the folks that come from the health educator background or Planned Parenthood background who have a lot more comfort, but they weren't really talking about it till they got to the are you pregnant question. And so we said, you know, what if we just kind of take a step back from that? If we're thinking about ourselves as trying to support survivors to have long-term solutions, support around their sexuality, their parenting, their family planning, what they want for themselves. So this is for people who can still birth babies and for people who are beyond, like my age, but are still engaging in sex and sexuality. What's that approach? And so we said, you know, we want to have a different approach. So this is where we came with the don't ask, just tell approach. So some of you still may be engaged in screening. So this is not meant to disparage the work that you're doing, but to say, here is another approach that you can come at this, because we know that people come to us for all kinds of reasons: housing issue, sexual abuse issue, child sexual abuse issue, actual violence, I need something out of court, protection order, custody plans, I need help with housing, I need help with job search, all kinds of reasons, and they might not be talking to you about the fact that they had unprotected sex so that they could calm their partner down, see their kids, get some food, get some money. They may not talk to you about having unprotected sex because that's just not their priority and they're not thinking about it when they're calling us. And that may be something that comes out later, because there may be people who are calling you directly because they've experienced sexual abuse and they want to talk about that right up front. But especially for those of us in dual programs, people are calling us for all kinds of reasons. So we just wanted to how do we get that information out proactively, that we have emergency contraception, condoms, and birth control available, some birth control available, signaling that we're somebody you can talk to about sex, sexuality, your concerns. So we're like, let's just have this approach where we don't have to wait for a disclosure. People are afraid, not sure what they should tell us, not sure what we should know, afraid of being judged. It gives us an opportunity to talk about healthy relationships by just saying, you know, when you enter our program, wherever you enter, whether it's you're coming to a support group, or you're coming in for a legal clinic, or you're coming in for mental health counseling, or you're coming in for straight up advocacy or housing, when you do you might want to go to the next slide, Liz. Oh, no, go back. Oh, yeah, no, that's good. That's good. I see you have it there. When you're doing your kind of initial talking with people, so once people are eligible for your services, but you're doing that initial talking with people no matter where they enter, like here I can help you with, I just want you to know the kind of things we can help you with at our program. We have support groups. We have backpack and school supplies. We've got some emergency shelter. We've got some food here. We've got rice. We've got frozen peas, we have hummus, we've got emergency contraception, we've got Tampax, we've got condoms, we have pregnancy tests, we have stuff about protection orders. Just like really neutrally, not having to figure out who might need it, who doesn't need it. The person can take you up on that or not. The person can ask more about it or not. And then the next step we realized was like we were putting emergency contraception because of the cost. I think Brooke's going to talk about this later, but it can be repeated again. You can now get the one-step pill that Liz was talking about. It's called the morning after pill, Plan B, My Way, Early Way. I've seen just the generic name, levonorgestrel, for like $9 now. It's just on Amazon yesterday. $9.49 for one pill. So, you know, we could take $100 out of our budgets and just have some. So we were having it like locked behind a closet, cabinet door, because it was expensive and people had to ask us for it. And guess what? Some people asked, but they weren't asking very often. And so then we moved to like, how can we just have these things available in a way that helps people maintain their dignity, respect? They don't have to look us in the eye to take it. They don't have to sign off on any sheet to take it. So these are a picture of two advocates, two wonderful women in Eastern Washington. And what they did is they put up just a basic bathroom vanity cabinet up a little higher in the bathroom. They took off the door and they have a bunch of things in there. You can see emergency contraception is in that one container, but they've got organic lube, they've got condoms, they've got female condoms, they've got male condoms, they've got pregnancy tests. There's 8 things. I'm missing something. I can't remember what it is, but they've got all that stuff there. They don't put everything out at once. You just kind of have to see, but then nobody has to like ask an advocate for it. No one has to have that conversation. They can just take it if they need it. And so that's really been the don't ask, just tell approach, is like helping people maintain their dignity and their respect. And if you had that poster up in there that Liz referred to, I don't know if you can easily go back to that poster slide, Liz, because I want to show people something on it. The last column where it says risks of detection, we developed this poster because one of the things we were thinking about is like which forms of birth control interrupt a woman's period or a person's period who's bleeding and which forms don't. And obviously most do. And if you're in a coercive or abusive relationship where your partner is tracking your period, you kind of want to know that. So emergency contraception, one of the ways you know it's working is you do bleed and you do have cramps. I'm going to come back to that. There's a caveat with that. And the copper IUD does not interrupt your period. So we feel like this is good for advocates. This is good for the general public. This is good for people coming into using our programs to like just have that available. That was what the risk of detection meant. It was recognition that there's some people that are like, why aren't you pregnant yet? I didn't see that you got your period this month. What are you hiding from me? So that's why that column is there. So if you could go back to my slide again. You want to go to the next one? Oh no, go back one. Sorry, I didn't realize that was my last one. Okay, so the other thing that I just want to talk to you all about again, so a couple of things. When using emergency contraception, there's a couple of questions that come up for me all the time. Okay, if I'm a person on T and I'm taking hormones because I'm taking testosterone, is taking emergency contraception going to be unsafe for me? Absolutely not. It is not harmful if you're taking testosterone, if you're on T and taking emergency contraception. I have, however, if you did take emergency contraception and you are on T, you're definitely not going to bleed because the testosterone is suppressing your period if you still have ovaries. So you definitely want to take a pregnancy test within 2 weeks of that unprotected sex. And that's kind of the gold standard for everybody. Most people bleed who are taking emergency contraception and it's been effective, but not everybody bleeds. So if someone's taking emergency contraception, I still tell folks, take a pregnancy test within 2 weeks of unprotected sex. That's why it's helpful to have, again, on Amazon, you can get packets now of pregnancy tests that without all the packaging, we could send you, I think I've given those resources to Liz before, but don't go to the dollar store. They're kind of old and cruddy. Get the ones on Amazon, and I think you can get like 25 pregnancy tests for like $8. So you can have those available too. And it's kind of nice to have them available in your program too, wherever people enter, because if they don't want to take the pregnancy test alone, there's an advocate right there that can stand outside the bathroom and talk them through it and be there with them. So that's kind of important to know. I do have, for our programs, I put together a one-pager of kind of general rules around taking, general rules and expectations around taking emergency contraception that includes a reminder around for people who are on testosterone. Liz, would you like me to send that to you, to send to people who participate in this webinar?
Yes, that would be wonderful. Thank you.
Okay, so be happy to send that to you all as well. I think the last thing I wanted to say is that, you know, opening the door to just talking about sex and sexuality wherever we are, as I said, you know, even for people my age, I don't know if you all can see that I'm past reproductive age, or people who don't identify as women coming into your programs, just kind of opens that door. And what we found in talking to advocates around introducing emergency contraception and saying that they just had it here, emergency contraception, pregnancy tests, and condoms. Then at some of like support groups, people were saying, well, you know, what are you telling your kids about birth control? How are you having those conversations? Or I'll never forget a woman my age who said, you know, I'm glad you brought this stuff up. I'm not, of course, worried about getting pregnant, but I don't think my partner's being faithful to me, and I think I have an infection. And so like it just lowered that embarrassment to say, I'm worried about that. Can you all help me with that? And we've had survivors say, we didn't think you all dealt with that stuff, which is crazy to me. Why wouldn't we be talking about whole people's bodies, whole people's lives, their sexuality? So it's a part of this is like building our own confidence and competence. We don't have to know everything about birth control. There's some great resources that Liz identified. We don't have to know all the things, but just in the same way we know a lot of key things about a lot of other resources and systems that survivors we work with need, we can know enough to know that are some forms of birth control that are less likely to be felt by a partner, that emergency contraception over the counter, the one-step pill, is available for everybody, no matter what age, no matter where you live, federal law, so that we can do some advocacy if that one pharmacy in town is giving people a hard time, you know, in our rural areas, or we can just have it in our desk drawer, just like we have Tylenol and Advil and everything else. You can have it in your desk drawer. You can lower those barriers. Even if we send people to emergency rooms, they got to fill out a piece of paper before they can get emergency contraception. So it's not easy, and it's so hard. By the time people get to us, they have really had to overcome a lot of barriers. So let's just remove a few more by having something like emergency contraception, pregnancy tests, and condoms available, easily available, no matter how people enter our program. Then we're engaging in liberatory action, and we're really supporting people as fully as possible. So thank you for my time. Any questions, throw it up in the chat box and keep going.
Thank you so much. Brooke, I'm going to advance the slide and send it over to you.
Great, thanks Liz, thanks Leigh for all your great information. Sorry, right as soon as I start talking, there's sirens screaming down the street. Sounds like they're going away. Hopefully everyone can hear me okay. DVP is really excited to be able to provide sort of what we're calling like a starter kit that has some really great resources. And organizations will have access to these. They're going to start being delivered to you or mailed to you within the next week or two. For folks who are going to be attending some of the trainings next week, you'll get your kit at the training. If you're not attending the training next week, you'll receive an email, or you'll receive it through regular mail. So basically the kit that we're providing has kind of just a few resources for everyone. And we really like the idea that Leigh had mentioned about putting this kit in a very visible place in the shelter. So in the bathroom, someplace where it's private, but also that someone can reach it and doesn't have to have permission to get these resources directly when they have a need. And also making sure that you all as advocates kind of explain that you have it there, because some people just may not see it. And so we're, Liz, do you want to go to the next slide and I can just talk a little bit about what is in these kits. Again, I said it was a starter kit, so basically that means we're giving you all the materials you need to kind of get going, and then the hope is that programs will want to refill the kits or come up with their own kind of like mini kit or something that they want to have available, sort of like in the picture that Leigh talked about. So the kits that we're providing for programs have external condoms, internal condoms, which you may be more familiar with them being called female condoms, the morning after pills, some pregnancy tests, and then some written materials. So we have some of the Futures Without Violence materials about reproductive health. The instructions for everything are in both English and Spanish. It's little funny story, when we bought the morning after pills or the pregnancy test, I can't remember which one, the instructions were in German, and we didn't know that that was going to be the most useful, so we were able to go online for the company that manufactured those and find the instructions in Spanish, and we printed those to make sure everybody had copies of those. I guess that's just kind of one of the things that can happen when you buy things on Amazon. And then we purposefully bought a clear box for all these items so that when survivors are looking for things, they don't have to like dig through it. They know exactly what is in the box. And we are just, really excited to kind of hear how maybe we'll try to circle back with programs in the next couple of months to see how this is going and kind of what things have come up and how these have been successful. So we're just really excited to be able to have this opportunity to provide all these resources and put these kits together for everyone. And I wanted to, again, to thank Liz and Leigh for sharing their expertise around this. And we wanted to make sure that programs had kind of some of the background information about why we're doing this and why it's important. And hopefully you all can, continue to find these really valuable and, consider it sort of like just the regular things that you provide for DV survivors, the same way you would provide food or cleaning supplies for the shelter. So, and again, you don't have to be a residential program to have the kits if you are non-residential only, and there's definitely a need to have conversations with survivors around reproductive health. So please feel free to, give us some feedback about the kits and let us know how it's going.
Great, thank you so much, Brooke. So does anybody have any questions for any of us? You can either unmute yourself or type in the chat box if you have any questions. So just while people are thinking about questions they might have, I just want to let you know, like, this is just an opening conversation, right? So we can do a lot more training and support and technical assistance, and we want to be here to support you through this process as you're thinking about this. So please don't hesitate to reach out. I'll send out the slides with the links to the materials probably later today. But we want this to be the beginning of an ongoing discussion about how best we can support survivors in their sexual and reproductive health.
I have a question for the participants. Liz?
Yeah, absolutely.
So how many people, is anyone offering condoms or pregnancy tests or emergency contraception now at their programs? Is anyone doing that now? Any of the three?
You can, if you are, go ahead and type it in the chat box, or you can raise your hand. You can use the raise hand function.
I can't, yeah. I don't know if I can see that, but you can tell, Liz, right? Tell us. I can see the chat, but not if people are raising.
We have one program that says they're not doing that.
Okay. Does anyone have, like, one of the concerns that came up for us, for programs we heard from advocates, was like, well, literally, how do I introduce this? And am I going to be offending someone who might be from, am I going to be offending someone by offering it because of community or religious beliefs or anything like that? And so we talked about, like, you know, there's so much information we want to go over with participants as they come into our programs, wherever they enter, that it's like hard to remember things. So instead of like making it something a survivor would have to check off, it was more like, how can we make a staff prompt for ourselves? Like, are there any cards that you all have available to you to remind you to do things, or any one-pagers, whether it's part of intake or that safer planning conversation, where it reminds you as a staff person to say, hey, just want to let you know we've got emergency contraception here, some birth control. You don't even have to say, talk to me if you want it. Just let people know you have it. And the same thing with like safer planning, people felt like, well, the last thing on their mind is probably thinking about some of this stuff. But I've had survivors say to me, you know, the sex is the only thing that's good between us, even though we won't wear a condom. Or I just want to go out and have some fun, like some anonymous, no strings attached sex. And just like putting it out there as a part of safer planning. You know, again, do you want to take this is something I say to all of our participants. That's the way you can start at the beginning of a conversation when people enter your program, or as a part of safer planning. This is something we share with all of our participants. We've got some emergency contraception here, condoms or pregnancy stuff. Would you want to take anything with you? And people say no or yes, you know, but just like just not trying to figure out who it is, and then who might need it. And that's where like not always bringing it up around a pregnancy or unprotected sex question is helpful, because people are afraid, they don't know what to tell you. Like, what are you going to do with this information? Will you judge me? Some people are an open book. So finding other ways to just, you know, in a way that is neutral and dignified as possible, to just say this is something we share with everybody who comes through our program. The other thing around the offense piece, you know, my personal experience, I'm Jewish, and so I've done some, you know, I work at the coalition, but I totally support, we have a Jewish, I also have volunteered and supported our Jewish domestic violence sexual assault program in our community. And, you know, I have a story from a friend of mine who's a who's a primary care doc, not Jewish, who had someone come from the Orthodox Jewish community and ask for an IUD with the strings cut off. Why do you think she would want the strings cut off on an IUD? Anybody want to take a guess? You can put it in the chat box. Okay, no one, okay, let's see. Yes, that's right, Darlene. So her partner couldn't feel it. So like her religious obligation is to have as many children as possible. And I know she was over like she'd already had like 6 kids, and she was just like done. And so she stepped outside her community to get support from a non-Jewish doctor, because it's a very closed, insular form of community and within Judaism, and then didn't come back for a follow-up appointment, but sent a friend, another Jewish Orthodox woman who wanted an IUD with the strings cut off, and did not come back. And there's research that shows like Catholic women use birth control, use abortion services. So I think if we're just offering it to everybody in a in a neutral way, like respects people's dignity. There are many people who make decisions individually that might not align with their community's values, but they're doing it anyway. So if we just give people that, we're just giving them the information. They're going to choose to accept it or not. Just in the same way, if I, was talking to you and somehow when I came back, we were having a conversation, I somehow, hit my knee on your desk and broke the skin, you wouldn't say to me, I'm not talking to you anymore till you put this Band-Aid on. Not talking. Mm-mm. You would say, I've got a Band-Aid, I've got some cream, you want anything? I would say, yes, I want this, or no. Same thing. We're just offering this out to people, and people have the choice to do what they want or not. But it is in service to this longer, bigger vision. I think that's what we can feel confident about around really supporting people holistically. So that's why I think that clear box is so great, that people can just, if it's in a place where people can access it, they don't have to talk to an advocate. It's just there. They can just look at it through their leisure, see what they want, see what they need, and then you all see how it goes. There's always the outlier. Somebody takes everything, and then you're like, well, we can never put it all out again because somebody takes everything. But it's not like that. You kind of have to give yourself a couple of months to see how things go with your resources.
Yes, absolutely. We had another comment in the chat box, somebody who works with youth specifically and worries about parents' reactions, but the program in general encourages and knows that youth can make their own decisions after 12. Do you have any experience or tips about working with families in that matter?
Well, I'm assuming, are you working with the whole family when you're working with that young person? Or are you working with the young person? Or let me just answer both ways, because I'm not sure. So, and I don't know what I should have looked it up, but I don't know what your laws are in Colorado. Maybe you can help me, Liz. Do young people have to provide notification or get consent if they're accessing birth control in your state?
Not after 14.
Not after 14. Okay. Legally after 12, they are okay.
12. Mm-hmm.
Yeah. Okay. So in our state, minors of any age do not have to get parental consent or provide notification to anybody if they're accessing birth control services or abortion services or perinatal services, actually, too. So I think it's the same thing. We've had young people say to us when we've done some focus groups around this in middle school and high school, it's like, even if they're not ready for birth control, they want to know about it, and they would like the adult to be comfortable talking to them about it. And if you're working with the whole family, and I don't know what the scenario might be, you have a young person who asks you separately if they can have emergency contraception or have access to it. I'm not sure what the scenario is, but if you're working with the whole family, to say that, oh, just one-on-one with the youth. Okay, yay! If you're working one-on-one with the youth, I really come back to what young people have said to us. We want the information. Oh, cool, minors of any age, great. We want the information even if we're not ready for it. So please talk to us about it. Again, emergency contraception isn't going to hurt a developing pregnancy or the person taking it, but it would be an expensive and probably not fun way if you took it a couple times a day. You'd want to talk with the young person about longer acting forms of birth control. And this is where maybe having a partnership, which some of you may already have, with local community clinic like the public health nurse, or a home visiting program that has maybe a nurse family partner that can come in and come to a support group and answer any question about sex, or come to a sex birth control and answer any question about birth control use, or come to a staff meeting and answer any question you all have. Because, I've had to get up to speed myself on a few things. Just make sure I'm really clear about some stuff. That can really be helpful, but I think it's okay to talk with young people about the information. Doesn't mean they're going to act on it. They want the information to help them make informed choices, and having you to talk with them is really wonderful. I hope I answered your question. So I see BC for you. What is that? Also, BC4U is a great resource. I see in the chat box.
I think it's a website that has some birth control options on it, and I'll include, and folks have included some resources in the chat box, and I'll include those in the email I send out too.
Great. How about Scarlet Teen? Have people heard about Scarlet Teen, all one word? So Scarlet Teen is fabulous. It's really designed for young people. It has, it looks like what young people want. Young people can ask any question, have any kind of conversation online. Scarlet Teen is fabulous. And also bedsider.org. So bedsider, just like it sounds, Scarlet Teen, just like it sounds, all one word. So bedsider would be more of the range of like adults, professionals, but still really good information. Scarlet Teen, definitely aimed at young people. I cannot remember the name of the woman who started it right now, but those folks who are steeped in sexual assault work will know the author, will know Scarlet Teen originator, because she's just done some of the most groundbreaking work in our country around sexual abuse, probably she wouldn't use the word victimization, but, advocacy work for folks. So that would be another good resource to take a look at, especially if you're working with young people. It'd be kind of fun to look at Scarlet Teen together.
And
Great.
This is Brooke again. I wanted to thank Zoa for chiming in and directing us to more Colorado-specific resources. Zoa Sheshki is our team lead and director of the Colorado Sexual Health Initiative here at CDHS, and their program just became a part of our Office of Children, Youth, and Families. So we're really grateful to have them working alongside us. And I think we kind of have, maybe Liz, we can connect you and Zoa for a round 2 webinar to talk about some of the Colorado specific resources and how DV orgs can connect with all of the reproductive health resources here in Colorado.
That would be wonderful. Thank you.
Let me ask you another question. We call the forms of birth control that are less likely to be felt by a partner, it's stealth birth control. I mean, I think the stealthiest form of birth control, if people actually have access to healthcare insurance, or if in Colorado IUDs are covered, is a copper IUD with the strings cut off. I mean, that's what we're talking about, because it can, if it's placed early enough, it can act as a form of emergency contraception. It doesn't interrupt your period, and it's there for a while, number of years. And there used to be misinformation about teens. Teens had to have a different kind of IUD, a different size. That's been debunked. No, they don't.
And in Colorado, the federally qualified community health centers, most of those have the copper IUDs available, and they work on a sliding fee scale. So folks can go in and get a financial screening to find out what their cost would be, but it's a pretty low cost in most places. So that's a great place to start referring folks to.
I'm putting the Scarlet Teen in the chat box because I just pulled it up because it makes me so happy. It's called Scarlet Teen Sex Ed for the Real World, so everybody can see it. It'll make you happy today. The other thing that comes up for us a lot, let me think, I had a thought with the forms of birth control. So yeah, I mean, we have had women tell us their partner, or people tell us their partners have pulled their IUDs out by their string, which is why we start talking about, thinking about IUD placement with the strings cut off. Yes, it's trickier to remove them. You need someone who has more skill. But if you're taking that choice, you're hopefully going to be thinking you're going to have it for at least a year, if not longer. I also wanted to ask, in Colorado, can you now buy at least birth control pills like a year's worth, or do you still, or can you buy like in Washington State now, a couple years ago, we passed healthcare legislation that you can buy a year's worth of pills at one time at no additional cost. You can have less if you want, but you can buy a year's worth, which can be helpful for survivors who may be finally getting to to get to the clinic or get to the pharmacy to get pills. Is that true in Colorado?
I don't know. I can definitely look into that. I know that some folks have done it because we've been talking about it in our Project Catalyst, but other folks have encountered insurance coverage challenges with that, being able to do it but not being able to be covered in the same way they would if they were buying it on a monthly or 3-monthly basis. So we can look into some resources about that for sure.
Okay. Because that's, and then everybody, I assume everybody knows under federal law, I'll just say it for the heck of it, that survivors of domestic or sexual violence can enroll for health care at any time outside open enrollment. Everybody knows that, I assume. Just doesn't hurt to say it over and over again.
Yeah, that's definitely, yes, we have some materials about that, so I'll include that with that. Yeah, that's part of the information we're sharing through Project Catalyst.
All right, and then I just shared the bedsider.org in the chat box too. The other resource I was talking about. And then I see your 13-year-old gets 3 months at a time on a prescription. It's free in Colorado. Yeah, that's great to know, Catherine. Thank you. I just wondered if, well, Liz will find out. Can you get can it go up to a year? Can you get as much of a year? I think people are trying to do that more and more.
Yeah, that would be a great.
And if there are any, like our state, we just, they may default to 3 months, but that doesn't mean you couldn't have longer. It would be an advocacy issue. So that's why it's good to find out. I see your response, Catherine. The other thing I'd want to know about, like, I'd wonder if you all have had any reproductive health care legislation passed that includes more around trans health or immigrant or health care for immigrants. Has that happened in your state?
What you mean, like funding for programs and services, or? No,
just like legislation legally. So like people who have trans health needs can get, can't be discriminated against, can get access to birth control or screenings they might need around certain things like cancer or pap smears, because like sometimes people, people who are on T still have ovaries, cervixes, all that kind of stuff. Like we just passed some protections in our state in this past legislative session. I just didn't know what was, that might be something to add to the list for Colorado if there's anything. I can send you a summary just up from the bill because it's not even enacted till, well, maybe just end of the month from the bill language to see if anything happened in your state too. Might be helpful.
Great. That would be fantastic. Thank you.
Is there any other questions people have just about like, well, how do we really do this? What does it really look like? How do the words come out of my mouth?
Not seeing any other questions. All right, well, if there are no more questions, I just want to thank you both, Leigh and Brooke, for participating in this. I think this is really great information and is really going to help our advocacy. And I'll put together all these resources and make sure they get out to everybody. But also just feel free to reach out to me. I can connect you to Brooke and Leigh, and we can, if you have questions, I'm happy to help you navigate any concerns or situations that may come up.
Yes, happy to support you all. Great I'm so happy you all are doing this. You're obviously pretty radical and awesome advocates. Yay.
Yes. Well, thank you so much, everybody, for attending, and we will be in touch soon.
Thank you. Have a good day.
Thanks, everybody.
Take care.
Bye. Have a great weekend.
Yes, it's Friday.